Hi, this is Professor Marcus. I'm here with our last question type of the semester for your drug information sessions. So our last question type is kind of a combination because the two things tend to go together, but we'll cover them distinctly. So that is drug dosing and drug administration. And we're going to cover the topics of what are the usual methods by which drugs are dosed, how do you find dosing to suit a particular patient, and then kind of crossing over into administration, how do we advise patients about how and when to take their medications in a way that uses language that's understandable and not medical speak. And as usual, we'll be focusing on where you can find this information in the big three compendia. So we'll start with just a brief overview of drug dosing. You'll definitely get more information on this in your coming coursework, but I wanted to kind of set the context of what you're going to see in the compendia. So one of the most common ways by which we dose patients is what we call just a fixed dose, and that means that basically all patients get that same milligram, gram, milliequivalent dose based on a certain indication for use. And this is the way most of our common solid dosage forms are configured, right? They're made into the most standard dosing amount. In contrast to that, there are ways that we individualize doses. Some of these were probably introduced to you in your pharmacokinetics, pharmacodynamics block. And these is where we include additional considerations, so not just a single fixed dose, one size fits all, but we consider things like patient age, their body weight, which sometimes can be their actual body weight, or it might be their ideal body weight or an adjusted body weight. Most commonly, though, it would be the actual body weight, except for certain medications that have certain properties where we would dose them differently. Body size, this could be body surface area, body mass index, and you will learn how to do these calculations as well. And then sometimes another condition might change the dose that we would give to the patient. And this can be related to physiologic factors like pregnancy. It can be perhaps a condition that impacts another condition. And then most commonly, and what pharmacists are involved in a lot, is making individualized dosing based on a patient's organ function. So for example, when their renal function is declined and the drug is cleared renally, we need to make a dose adjustment. And then a final area of which pharmacists specialize is doing very patient-specific dosing based on that patient's individual pharmacokinetic parameters or how they handle the drug. And we will basically give the patient a dose of medication. We'll take some drug level samples, and from that, we'll be able to determine, for example, that patient's individual parameters of their half-life, for example, the way they handle the drug, and we use that to make a dose prediction or dose adjustments. And that's called clinical pharmacokinetics, which I believe Dr. El-Barbary introduced you to that concept. You'll learn more about how to actually do those calculations and make those dosing adjustments in the later part of your P1 year, and then in more intensity kind of in your P2 year. And then there are some kind of hybrids of an overlap of using a fixed dose, but with some individualization. And that is, for example, we see this a lot in pediatrics, where all pediatric patients of the same age range get the same fixed dose. But there are different fixed doses, for the different age ranges. So that's just to give you a bit of an introduction to some of the ways that you will see drugs dosed when you're looking them up in the compendia. So I'm going to have you pause here for a moment and take a look at some general categories of dosing type questions and some example DI questions that you will likely encounter as a pharmacist. And these can be largely grouped into dosing where somebody asks you for a dose by a particular patient population, like what's the max dose for a geriatric patient, what's the usual dosing range, for a pediatric patient, so I don't underdose them or overdose them if I'm presented with a prescription and I don't have specific information like about the patient's weight, what's kind of the general range of acceptable dosing. But most of your questions you will be given the indication and purpose of a medication, and you will have to find a dose that basically fits under that use category. And that's why we introduce you to the use methods and ways to look those up before we introduced you to dose. And then there are some variations, kind of subsets of dosing where perhaps even once you know the indication and purpose, there may be some refined dosing based on the stage of therapy, so where they are in the continuum of care, and also perhaps how severe their disease is. There is a large area of dosing that we will not cover this semester, but will be covered in the future, and that is about making dose adjustments or modifying doses for some of those subspecialty areas and subpopulations of patients that we know often require those individualized doses. I invite you to pause here for a moment and go ahead and read through some of the example DI questions before we continue. All right, so to give you a little more terminology that you're going to see in your compendia, these are some of the terms that you'll encounter in the way that doses are articulated in the compendia, because you'll see usually not just a single line of information about dosing for a particular indication, but you may see some of these other terms. So there's usually a starting dose. Sometimes this is called initiation. So different compendia will use different terms. Occasionally you may also encounter the term of a loading dose. And this is a way that we give usually a single dose. Sometimes it's broken up into 2 doses of the medication to basically get the patient up to steady state more quickly by giving them, filling the tank, so to speak, with a dose. Another strategy that you'll see is dose escalation or dose titration, meaning that we give them a starting dose, whatever that dose amount is, say 10 milligrams, and then we gradually titrate them up, and usually the compendia will tell you like how fast that can be done. Like you can increase from the 10 milligrams once a day by 5 milligram increments once a week or something of that nature. And usually what you're trying to titrate up to is your maintenance dose, or in some cases, if it's a guideline-driven recommendation, it might call it a target dose. Those terms are kind of used interchangeably, but this would be, the goal dose that we're trying to get the patient to and the dose that they're likely to be on for quite a while. Occasionally, though, we have to interrupt therapy and make a dose adjustment or a dose change from that, for example, maintenance or target dose. And this would be a situation where we want the patient to continue on the drug, but we need to make some adjustment, like perhaps their kidney function suddenly declines and we need to make an adjustment there. Or perhaps they're not tolerating the medication as well as we would like, so we can't stay quite at the target dose. So we will, decrease the dose a bit with the hope of maybe being able to get them back up to the target dose if they're able to tolerate a side effect. Most drugs will not tell you a specific maximal dose, but if that information exists, you can obviously look for that. In the absence of it specifically calling out a maximal dose or the cap dose, meaning the top dose that can be used, you can just look at whatever dosing range is presented to you. And usually what I would say in that case is there is no specific information about maximal dose, but the top of the dosing range is usually X. And I would use that as kind of a surrogate if there's no specific maximal dose information provided. On the kind of the opposite side of dose initiation would be a discontinuation of therapy. So this would be a situation where we need to de-escalate the dose or titrate the dose down instead of just abruptly stopping the drug. And you will see this for some of your drugs in your top 200 and definitely in your career. Some medications we do not abruptly stop, and this can be for a variety of reasons, but one of the most common is that there might be a withdrawal phenomenon if we abruptly stop the drug. So in those cases, you will see wording like titrate down, taper down, or it would be listed in the compendia as a discontinuation of therapy recommendation for like how to do that. So not all drugs will have this information because not all drugs need to be tapered or titrated down. A couple other terms that you'll see more for certain subsets of medications, particularly anti-infectives, is the term of empiric dosing and definitive dosing. And empiric dosing is when we are not sure exactly what we are treating. For example, in an infection, we're not sure what's the causative organism. So we are dosing empirically. We know they have an infection. We suspect it's of a certain type of infecting organism, but we are empirically dosing based on what organism we think is there. Once we get back some lab cultures and we know for sure what the organism is, then our dosing may be refined to what we call definitive dosing. So again, you'll just see these terms used in the compendia, so I wanted you to be aware of what they mean. So empiric is kind of our well-informed shot in the dark dosing, and definitive dosing is when we've refined it because we know exactly what it is we're treating. And a couple other special situations that you will encounter that I wanted to point out to you is some drugs do have those additional dosing forms, like the long-acting forms or different salt forms. And so in the compendia, sometime under the general monograph, you will see recommendations for drug dosing conversion. So for example, switching a patient from immediate release to extended release or vice versa. So those dosing conversions are usually the same drug entity, so not across drugs, but within drugs, how we convert, for example, from an IV formulation, so a parenteral formulation to an oral formulation, or between different dosage forms. And then the final concept that you might encounter in the compendia is recommendations about switching drugs. So this is across drugs. So for example, a patient is on one antidepressant and perhaps they're not achieving the benefit we want, or maybe they're having side effects that are too disturbing. So we want to switch them from one antidepressant to another. And your compendium may have information for you about how to do that. For example, can you just abruptly stop one and start the other one on the same day? Or do you, for example, need to taper down one while you're tapering up the other? So using paroxetine, which is an antidepressant that you will be learning about in your CNS blocks. As an example, I'm going to give you a quick view of where you would find information on dosing in our 3 compendia. And again, you can reference the where do I find it in the compendia attachment that is placed on the course along with this module. So let's start with facts and comparisons. So again, in your left nav, before we were looking at indications and off-label uses, but on facts and comparisons, with the section you will want to go to is called dosage. And again, you can expand it here to get a sense of what information is there. But essentially, the way most of these monographs are organized for dosing is they will have headers for the large patient population. So for example, here we can see that there's information about dosing for adults. There's some sub-information for elderly or debilitated patients. And for pediatrics, they say that there's really no information for this. And then they usually will give you, in facts at least, some general dosing considerations. And then they will give you for each of the subpopulations that you're interested in, the dosing recommendations sorted out by the condition. So they basically kind of take a blend of what we saw in use. They layer on these patient population factors, and they give you specific dosing for different indications. Where available, if we look here, for example, let's look for major depressive disorder. They have it broken down by are you using the immediate release paroxetine or the extended release. And then for each of those, we can see information about what the maximum dose is per day, what the starting dose is or initial dose, and how to do dose titration. For this particular drug, because it does have one of those withdrawal phenomenons, there actually is a section on discontinuation of therapy. And they talk in here about how to go about doing that. And it says that it needs a slow taper, so decreasing the dose over 4 weeks. And that has to do because of the shorter half-life of this antidepressant compared to some other ones in the class. They also have some sections on here about switching antidepressants, and it has some information about conversion related to changing between the extended release and immediate release products. So that's a basic entry to facts and comparisons. Let's look at LexiComp. So in theirs, it's called dosages. And you can see that they have kind of a similar outline by general patient population. Here are some of those special populations. This was also true in facts and comparisons. I just did not highlight that because we won't be focusing on these dosing adjustments, but that information does exist there. So many of them often do have some general information at the very top of the monograph about dosing. And I do usually encourage you to read this general section before you just jump into finding your specific indication, like here, for example, major depressive disorder. This is often where they would talk about some of the switch information, some general precautions or approaches to dosing. So it's very helpful usually to read this. And then finally, in micromedics, here's our paroxetine. Again, I would usually use the in-depth answers section of it. And it's the very first part of their nav called dosing and administration. And you can see here it automatically shows us a navigatable hyperlink, but you can see how it's organized here with, again, adult dosing information, then pediatric or subpopulation information. They put all of their dosing adjustments under a separate header just for your information. So if we were to look in this one, you have to kind of decide, again, which formulation of the paroxetine you're going to use. Hydrochloride is the most common one. Here we can see some of the different diagnoses that we could navigate to find. So let's just take a look here. Major depressive disorder, we're again under adults right now, and it gives us information for initial dosing and titration and maximum dosing depending on the formulation. Now we're going to switch gears to a related topic, which is about drug administration and kind of a correlated counseling points, because oftentimes that's one of our main counseling points to patients is about how to take their medication, which is essentially what drug administration is focused on. So I'll have you go ahead and pause here for a moment and read the example DI questions, but you can see that they consist of a variety of topics having to do with things that patients would need to know about taking their medications, like when should they take them, how or by what route should they take them, are there any special instructions for how to use that particular dosage form? Does it matter if they take it with a meal or not, or other implications of taking it with food? Does it matter if they take it with other medications? Do they need to space out their doses, for example? And then just as a kind of bonus topic, I wanted to give you some information about where you can find patient-friendly language. We need to be speaking with our patients in a way that addresses their health literacy and make sure that when we're using terms, that they're terms that the patient understands so that they can be successful with using their medications. So go ahead and pause here and read, and then we'll proceed on to the next topic. So I've provided this information for you, not really so much for your drug information questions, but just for your general practice, including your over-the-counter consults, your learning about the top 200 medications, and your medication counseling sessions with patients. So students often wonder where are good resources to find this patient-friendly language, both to describe different disease terms, what do I say instead of hyperglycemia? What's some patient-friendly language that I can use instead? And then likewise for medications, particularly when we're talking with patients about how their medications work or side effects, what is some good patient-friendly language that I can use? So for diseases, there's a great website on the Pacific Library LibGuide called Health Literacy for Interprofessional Education. And in this toolkit, there's a few parts that are particularly useful. Plain Language Tools tab, the Jargon-Free Medical Terms tab, and then they link out to Medline Plus, which I believe I had introduced to you in our very first session together. So those are great for disease-based patient-friendly language. For medications, within your compendia, there are patient drug information leaflets. If you've ever received a prescription at a pharmacy before, you were usually provided some paper that talked about your medication in patient-friendly language. Those are the drug information leaflets. Many pharmacies, their computer system automatically generates them, but if that is not available, you can actually access them from your compendia, and I will show you where to find those. Another open resource that the FDA has is called Daily Med, and that has a link to any FDA-approved patient package inserts or medication guides. So these are specific guides that the manufacturers have to prepare in patient-friendly language for their medications. Now, not all drugs have these. Really, it's the drugs that have these are ones where additional information needs to be provided to the patient, either about risk of the medication or about how to use it. For example, how to use an inhaler. There will be a medication guide for that in patient-friendly language with illustrations, for example, of like how to put together their inhaler. Another great resource is within different disease states, many patient groups have gotten together and they have advocacy websites that really talk about medications or diseases for that particular patient group. For example, the Livestrong website is really targeting cancer patients, but even more specifically, cancer patients that are younger than 40 years old. All right, so using paroxetine again as our example, let's walk through the three compendia, and I'm going to point you to where you can find administration and patient counseling information for drugs when you're looking them up in the compendia. And again, this is referenced on your Where Do I Find It guide that you can use going forward. So in Facts and Comparisons, nicely, it's under a section called Administration, which is helpful. The term kind of makes sense. And they will have information about how it can be administered. They'll usually talk about whether it matters whether you take it with meals or if there's a time of the day when it's best to take it. And also if the dosage form can be crushed or not will often appear there. So administration. Another place where you can find some information or counseling kind of information is here under this Adult Patient Education tab. And here's where you can find that patient leaflet, so patient-friendly information. So I often use these if I'm looking for some counseling points. It will tell me about like how it's best taken, what do I do if I miss a dose, some of these things that I want to be prepared to talk with the patient about. So that's just the Adult Patient Education tab. They also have one for pediatrics as well too. So I usually just go there directly, but you also can go to this patient information link here, which is kind of just a subset of some of the content that's complete in the patient education one. So this is a good resource, or just going directly to patient education as well. So there we showed you where you can find administration information and then also the information about counseling points. In Lexicomp, they have a section called Administration and Storage Issues, and this is the section where you would find your administration information. So it looks very similar information that we're finding here about they can take it either with meals or without, doesn't matter, preferably in the morning. If they're using it for most purposes, unless it's being used for hot flashes of menopause, then administer it at bedtime. And again, the warning about not crushing or chewing the extended release or film-coated tablets. For LexiComp, where you can find some counseling points is under this section called Medication Patient Education. Kind of similar to what we saw in Facts and Comparisons. They have some specific talking points. This one also has the tab that will give you the full patient leaflet. And finally, in Micromedics, again, under In-Depth Answers, here at the top is a section called Administration. And here it will tell us a bit about how to do it. Here they're saying, again, suggesting in the morning with or without food. All of this is looking pretty consistent with what we saw in the other monograph. Within Micromedics, to find some of those patient counseling points, they have a section called Patient Education. And here we would go to Medication Counseling. They're referring us back here to the quick answers. Here it tells us what we should tell the patient, what we should advise the patient, so we can draw on these for some of our counseling points. And then they do also have the patient handouts, which you can click on right here. And you can request them in different languages here. Also, you can jump out directly over here in this right nav to this Consumer Drug Information tab, and then click on your monograph. So if you just want to look at it and aren't necessarily looking for a printable form of it, you can go either way. All right, as has been our practice before, I have 5 questions of which I'd like you to choose 2 to research on your own and cross-compare across the 3 compendia, and then we'll reveal the answers to you. So just for your knowledge, if you're choosing to, the first 2 questions are dosing type questions, and the last 3 are more administration questions or counseling points questions. So I suggest if you're going to choose your 2, to take one from 1 or 2 and one from either 3, 4, or 5 so that you get both question types, but totally up to you. So you'll go ahead and do that. I expect it'll probably take you about 15 minutes to research both questions. So go ahead and pause here. Make sure you have done your own research before we reveal the answers, which will be coming up next. So here are the answers for you. You will get a debrief on these particular answers and how I found them separately. I look forward to seeing you in class. And I've highlighted here some of the differences between what I found initially across the 3 compendia. Overall, pretty consistent information was found. Nothing really, I guess, that counterposes each other, just some things perhaps a little more specific than others. Thank you again for working on drug information questions. I hope that you find this fun, and it'll be great access for you for your current content going forward. Now you'll be able to know where you can look up some more information about product information, about drug use, and also about dosing and administration.